Hi, my name is Shanika Boyce, and I am a pediatrician and the Assistant Dean of Medical Education here at Charles R. University of Medicine and Science. So as a pediatrician, one of the most common objections, especially right now, is autism. Parents are very nervous about what they're hearing in terms of vaccines being a major cause of these developmental language, behavioral, social issues that don't come on until they're about 2 years old. And so the thought is that, well, in the time period between birth to the only thing that they may have been exposed to is the vaccines. And so there's that causal link to it. And so most often we have to try to educate on that. Other less common causes and objections to vaccines is just, more of the local reactions to it, not being aware of the purpose of the vaccines, especially if they haven't been seeing a lot of the viral or bacterial conditions that the vaccines help prevent. The thought is that they no longer exist, and so they don't understand the importance of still giving that protection to their children. How I build trust with my patient is by providing education. I feel like I try to be as non-judgmental as possible so that they feel comfortable to discuss questions that they may not have felt able to discuss with other providers before. And also, through knowing exactly what are their major concerns? What have they heard from friends, from family? What have they experienced? And being able to show from my experience as a physician, what I've seen, what other colleagues have seen, how, there may be, some misunderstandings. And so by being able to provide that education to them, then there's better trust because at least they feel like I'm listening to them. I think that's a key part if you're listening to the patient and then they will respond back to you, but also that they know that you really want to help them, want to help their family, and that you're just providing more education and awareness. In terms of strategies to help with, eliminating some of the myths out there in terms of vaccines, it is letting the patients know that the vaccines have been around for a long time, letting them know that we've seen low numbers of, again, viral illnesses like measles, for example, like polio, for example, that we're now seeing a rise of. And the fact that, one factor is that, there's less, some patients who are parents who are no longer vaccinating their children. So again, these viruses are still out there. They haven't been eliminated completely. We just don't see the numbers because of the vaccines. They're helping to keep those numbers low. And so, it's in helping them to see that there is that relationship between, okay, now that we're no longer vaccinating as much, we're seeing these illnesses coming back. And so, we definitely need to, make sure that they understand that and that they see that. There's a lot of additional knowledge out there in terms of what they see on social media. And so you are having to provide that alternative for them, but hopefully, again, through meeting them where they are, hearing them, it kind of helps for them to see, okay, you do want the best for their child. In terms of cultural norms, I think we definitely have to understand that, in families where there's still a bias and also a fear of needles is a big one. And so it's helping the parent, because as much as I'm a pediatrician, but I'm also very much dealing with the parents, helping them understand how important it is. There are techniques now being used. There's different methods at some clinics that they can, use to kind of help reduce that fear of needles. And so kind of utilizing those techniques as well. But it's, you definitely have to again, it comes down to education. A big part of what I do is education, education, education. And so, again, you kind of try to connect with a patient, even if it means having to reflect on your own personal background, things that may happen in your family, and say, okay, you know what, like this is, I can understand because I may relate on that level with the patient, but this is also what I've seen. And how experiences, again, seeing a patient who has, again, not been vaccinated against things like meningitis, who end up getting meningitis, and unfortunately you kind of see the effects. And I definitely have seen that in residency still, in practice. And so it's, you want to be very careful in how you relay that message to the parents, so you don't scare them necessarily, but at the same time help them to see the importance of it. And yeah, I mean, as much as you can through experiences, trying to connect with them, but knowing that, again, bias, cultural bias, but then also fair is a big part. And so you just have to understand that and maybe educate, for example, myself on that, to know, okay, well, how best can I then relate to that patient and the parents to be able to kind of help them to see the importance of this. So I did have a family with a 9-year-old mom who came in with her 9-year-old daughter, and they were at the point of getting HPV vaccine. So the HPV vaccine, human papillomavirus vaccine, this is a vaccine that we give now to preteens. And the goal is, the reason why we do it at that age is because it's before they become sexually active. Well, most parents are not, they don't want to see their child as being sexually active, or even wanting to think about it to where they are starting to try to prevent any of those illnesses. So, it did, when I kind of brought up the topic to mom and said that, well, she's at the age now where she can get this vaccine, there's a lot of questions, about, well, why does she need it? Isn't this too young for the vaccine? I don't want to, create any issues where it may make her more promiscuous all of a sudden, right? So there's a lot of, again, misinformation, a lot of personal biases, a lot of personal concerns. And so at that point, it was more education. Well, this is why we're giving it. There's no assumption that your daughter is sexually active right now. But we do want to make sure that when it comes to the point where she will be, that she is protected. And, the virus itself can cause, various illnesses, and then going into more of what those are, including cervical cancer, which, no parent wants their child to experience. So, and even, the vaginal warts. So it was through discussing why, allowing mom to see that it was in no way insinuating anything about sexual activity, but just prevention, and making sure that, her daughter from now until when she's really 26, because the vaccine does, goes up to that age group, that she, will be protected. But beyond that, but, there is that time period to give the vaccine, then, I was able to she was able to think about it. She thought about it for, a few minutes and felt comfortable knowing the information. So it's through education, knowing the information, that she was in, like, okay, I think it's fine for her to get it. So that was, I think, a very, great way of seeing how education is, and, it's, a great tool. It's very effective, but a lot of it is just lack of knowledge and just being scared of the unknown. And so being able to help mom see that this is what we give to all kids now. It's not just, that there's, again, not for high risk kids, it's for everyone.